Hello, everyone who is slowly joining us this morning. We'll just allow 1 minute for people to come online and then we'll be kicking off shortly. Welcome, everyone. We will get started. Thank you for joining us at this webinar on delivering effective local health and employment programs. If that's where you were expecting to be, you're in the right place. My name is Elizabeth Gerard. I'm a Deputy Director with the Learning and Work Institute, and we are an independent policy and research organisation focused on lifelong learning and better works, and particularly looking at what works best and for whom when it comes to labour market issues. So we're very lucky to be working with our partners at the Institute for Employment Studies on the Labour Market Evidence Programme. The program is commissioned by the Department for Work and Pensions to fill evidence gaps and ensure that local policymakers and practitioners have accessible and reliable evidence to inform the design, commissioning, and delivery of employment support, giving people the tools to do the job. Part of this work is bringing together and translating the existing evidence base on active labour market policies and turning them into practical resources that people can use that meets the needs of policymakers and local government and other regional leaders. So the webinar today presents the findings of one of eight reviews that will be completed as part of this program of work. Today we will be discussing what lessons we can take from the evidence about delivering effective local health and employment programs. And the focus on this topic is more relevant than ever. We now have 8.5 million people out of work across the UK because of poor health, which is creating a growing challenge for local and national policymakers. And we know that high quality and locally tailored work and health support can play an important role in helping people move into work to remain in work or return to good work if they've spent some time out of the workforce. And there's already a lot of focus in this space. You might be involved in the DWP's WorkWell pilots, which is rolling out nationally shortly, or the NHS's Health and Growth Accelerators, amongst the other many myriad locally delivered and designed programs. And this issue is also the focus of the Keep Britain Working review led by Sir Charlie Mayfield, which at the start of this year, or towards the start of this year, made recommendations to government about what should be done to help people stay in work. And that review really highlighted some key evidence gaps, which make it hard for employers and policymakers alike to know what the best approach is to keeping people in work or helping people into work if they are living with a health condition or disability. So that's a bit of scene setting for you, and let me tell you about what you can expect from the agenda today. So first you'll hear from Mags Bexon, a research manager here at Learning and Work Institute, and she will present the findings from the evidence review on the design, delivery and evaluation of local work and health programs. Then you will hear from our wonderful speakers today who will share their perspectives on the key issues in effective practice. I'm very pleased to be joined by Gary Fraser, Head of Quality and Impact at Cumbria Youth Alliance, and Catherine Hale, a disability researcher with the Wishes Project. And I'll ask them both to introduce themselves a little bit more fully in a moment. Then after you hear from our wonderful panelists, we'll open the floor to a Q&A section of the morning. So this is where we are keen for your participation. So please use the Q&A function to post questions as we go, and we'll get to those at the end. And I think that is enough scene setting from me. So I will now hand over to Mags to take us through the review and the key findings. Over to you, Mags.
Perfect. Thank you, Elizabeth. And apologies, everybody. I'm having technical issues. So no can't see me, but I'm here. But please do flag if I also have audio issues, but hopefully everybody can hear me okay now. Yeah, so as Elizabeth said, I'm Mags. I'm a research manager here at Learning and Work Institute. Have the next slide, please. So I'm going to talk through some of the key findings from, and this is the first Rapid Evidence Assessment, or REA for short, as part of the Labour Market Evidence Programme. And this is focused on what enables the effective design, delivery and evaluation of local work and health programmes. I will put a link to the report is now published. I will put a link after I've presented in the chat, so you'll be able to go away and have a look at that when you have time. Have the next slide, please. Okay, so what was our scope then of this first REA? So the REA covered programmes and interventions focused on region, local authority, mayoral, strategic authority or integrated care board area in England, Scotland, Wales, or Northern Ireland. And all of these programmes included clear elements of local tailoring and flexibility. We were looking at programmes that had a target population of people aged 16 to state pension age. The things that we looked at in the evidence review must have had a focus on work and health outcomes. And also we wanted to set clear boundaries as to when the study had been published. So we had a period between 2017 and January 2026, which is when we concluded the review. And these criteria were selected to ensure the findings were directly relevant to the design and delivery of work and health programmes in the current UK context, and also to ensure that the review could be completed in the good timescales that we developed for us. So while the programmes, evidence from other policy areas could potentially provide additional insight and could be included in further reviews. Just to note as well that some of the key programmes that we identified as part of doing the REA were actually in the midst of being developed and delivered, and evaluations probably upcoming. So any future review could encompass evidence from those as well. And in some instances, we came across locally led activities where evaluations hadn't been published or hadn't been conducted. So just to kind of scene set in terms of the number of publications that the review draws on. And so we had a real range of, we scored all of the studies for strength of evidence. So some of them that you'll see if you look in the report were scored potentially lower quality in terms of the evidence, but that's not to say that the evidence that we drew on to answer our research questions was low. In some instances, the quality of that was high, but because there were kind of a limited number of reports, because of the reasons of some evaluations upcoming, some things not published, then we decided to broaden the horizons for the search. So that's just kind of to set the scene and the context, particularly if you go away and have a look at the report afterwards. But now I'm going to talk about what we found, which is the most interesting thing about the review. So next slide, please. So the key findings then in terms of programme design and implementation. And just to flag, the full report does include plenty of case studies of what we saw as good practice in all of these different areas. And I'll signpost some of those as I go along in my presentation. But when you look at the report, you'll be able to see that kind of learning in action and that insight from real world settings. So in terms of programme governance, it was clear from the studies that there was a real differentiation between operational and strategic governance, and that where programmes have been successful, time has been invested in developing a shared understanding, and often there would have been a lot of work done behind the scenes to build on local networks of partners to help that governance. And what was clear from the studies is that there was a real mix between the strategic and the operational governance. So we found that operational groups tended to meet regularly, sometimes weekly, often monthly, and those kind of more strategic meetings happen less often, perhaps quarterly. But in where we saw good practice, there was real collaborative structures between these two, the operational and the strategic, and that provided real opportunities for partners to meet and to discuss challenges, identify enablers and blockers and how those could be removed. A couple of really good instances that you'll see in the report is from the Talent Match programme and also from Working Well. So in terms of partnerships, what seemed to be coming across from the studies was local integrated partnerships, which is where new systems are created, rather than coordination, where activities linked are key for successful programs, and this ensured effective referrals and delivery. We could see from the studies that strong and well-connected leads really were integral in supporting this. We saw this from the Working Well evaluations and the No One Left Behind in Fife, as well as in Durham Works Futures. But it's clear that developing those partnerships takes time and effort, and having those local connections has been really key to having that impact on people who are taking part in support. And talking about people taking part in support, we wanted to find out about how service users were involved in the delivery and perhaps the programme design. And that was one of the areas where there was less evidence in the research, but where it was mentioned, there were multiple ways that different programmes were looking to involve users. The Step Forward Tees Valley programme, No One Left Behind again, they had real clear examples of how service users were involved. And generally, we could see that service users were involved in co-design. So right at the start of developing what the scope of support could be, Step Forward Tees Valley had 6 delivery ambassadors who were advocates for the programme. Some service users took part in qualitative interviews to help develop the design of support. They were also involved in evaluation activities, such as contributing to theory of change development and perhaps testing some user-facing materials. But just to be clear, the evidence does flag that while involving service users is really rewarding, it can be hard to implement and needs time to do well. So it'd be great to look at the case studies because there's so much to learn from those in the report. So finally, in terms of the programme design and implementation, devolved and flexible funding arrangements and an absence of payment by results it's really clear that this has enabled person-centred, holistic delivery. And these forms of delivery we can see from the studies, are really responsive to local needs and context and the changing circumstances and context of the service users themselves. So initiatives and programmes funded by government or other large funders, such as philanthropic organisations, we could see that really tapped into the having those flexible funding arrangements. The Working Well evaluations, we saw that they frequently noted the importance of the aims being defined by local needs and priorities, and having flexibility and funding really helped to embed that. Talent Match, one of the case studies in the report, took a test and learn approach, and there's some really good evidence there of how really being kind of flexible and thinking about how funding best meets the needs of the service user can actually help really embed some good design of the support. If I could have the next slide, please, that would be great. So these are key findings relating to local evaluation and effective use of MI. And I know, Gary, I'm not going to touch on your toes, hopefully, too much, because you'll be talking through some of this in a little while. But we found from the studies that evaluation works best when it's built into programme design, feasibility testing, and implementation. It can be where this has worked well. It links to program delivery, evaluation frameworks, and theories of change, make it clearer what works for who and why. And that this has supported changes to ongoing delivery as well as design of future programs. So really, really important to kind of build this into design and be thinking about how the impact of the program is going to be felt, and really getting that in at the start rather than the program had been going for a little while and the evaluation activities comes in much later. So the examples that we see really see where that has been the two things going alongside. Not easy to do, but definitely pays dividends. A lot of the studies talked about the importance of management information, or MI, and how important it is to have a clear strategy for how that MI data is to be used. And that is both support the delivery and learning, as well as monitoring and reporting. So to kind of get that live feedback in terms of what how service users are finding their progress through support. And it's also, the studies highlight, it's also important for visibility of performance, how the intervention or support is going, and also to help keep staff engaged in what is being delivered. Embedding this kind of making sure that MI is really aligned to the outcomes of the finding out outcomes of the support has meant, we can see in the studies, the delivery staff are more likely to support the data collection because it is arduous, and that's been highlighted in studies. There are examples of at GMCA, MI was presented as a shared resource, so local authorities, delivery providers, and integration boards were able to access it to monitor delivery, to understand participant needs in a live way, track outcomes over time, and dashboards were made available to all partners there. And also there are examples of where MI is actually used as a tool for advisors delivering the support to allow a structured assessment, and helping those taking part in the support to feel more confident discussing sensitive topics. So it's kind of MI for two purposes. And also kind of thinking about having strong aims for the evaluation, we saw in the studies can really help strengthen and develop evaluation capacity within the local areas and within staff teams. And we've seen this has long-term benefits in terms of upskilling staff, and more immediate benefits is increasing staff engagement in evaluation activities themselves, which obviously pays dividends in terms of finding out just how effective these programs are. We saw examples of local staff were trained by evaluation teams on things such as ethical research practice, informed consent, baseline data collection, and we saw that this significantly increased frontline staff capability in research and also in the quality of data that was being reported. Local stakeholders we saw were actively involved in evaluation design and governance, and that really was very beneficial. And coming back to something I talked about earlier in terms of the service users, designing key tools and research tools such as theory of change, co-designing those with local partners also help strengthen the overall the depth of the evaluation activities. So lots to learn about from there as well. So that's just a real kind of flavour of the key findings. There's so much more in the report, and I'll share that link in a moment. But just to flag as well, so that is the link I share will be the full report, but we currently developing a series of top tips that will be published very soon. And these focus on 4 things. These focus on governance, designing and embedding MI and evaluation into programs, learning from program delivery, and the final top tip section is on engaging service users in program design. So they will be coming soon. So I'm also going to flag in the chat 2 ways to kind of keep up to date with what's coming out of the labour market evidence programme. So it'll be 2 links to sign up to our newsletter here at LMW, and also to sign up to IES's newsletter, we're partnering on the labour market evidence programme. So signing up to those, you'll definitely hear about everything that's coming up, both in terms of the top tips and also further activity on the programme itself. And obviously happy to take any questions later, but I'm going to hand over to our panellists now.
Brilliant. Thanks, Mags. So next up, we'll hear from Gary. Over to you, Gary. A bit of an introduction about yourself and some opening remarks about the perspective that you bring.
Thank you. Yeah, so Gary Fraser, I work for Cumbria Youth Alliance as Head of Quality Assurance and Impact. Cumbria Youth Alliance we're in our 26th year now. We're primarily an infrastructure organisation that's providing support to partner organisations to develop good governance, to look at workforce development and training, and to help make sure that partners have correct policies and procedures in place to be able to offer safe, quality provision to young people who access services, as well as delivery where delivery's got a strategic purpose. So that's CYA. So in 2022, we were awarded development grant funding through Youth Futures Foundation, and that was to work in partnership with the DWP to design and implement an evaluation-ready employment programme for disadvantaged and those young people who were longer-term unemployed, 16 to 24, to help them move forward into employment. One of the main focuses of that was to really understand what works. So when we looked at designing that programme, it was looking at those measures to really pull out of evidence what works and what are the real drivers of change. And then with the longer term view of using that methodology in an RCT or a quasi experimental design, in which we tested the mechanism through development and then through feasibility study, and then hopefully would have gone on into a full study, but unfortunately, due to other circumstances, weren't able to move forward into that. One of the conditions of the grant was actually to source and implement and embed a management information system. At the time, our process for data capture, as many other organisations, was to use multiple Excel spreadsheets just to document those sort of numbers, if you like, hours of engagement, numbers of young people and outcomes. But implement a management information system really did help us develop our evidence base and our evidence structure. So that was a key part of that fund. So we've been delivering successful employability programs for a number of years in partnership with DWP and other delivery organisations. However, outside the usual, we engaged with 28 young people and 15 young people went into work, didn't really have an evidence base behind that to explain what it was that we did that delivered that impactful change and what it was that enabled those young people to move forward. What's the magic ingredient? What is it that sits behind that delivers that change? And that was just something we didn't have. So we had to start somewhere. So working with Ipsos Mori and then with the Institute for Employment Studies, we looked at our delivery over the years, over the projects that we deliver employability support, and started to document all the aspects of that alongside the outcomes we perceive would happen, or the outcomes that those elements do deliver. And then once we got that documented down, we then sat down and looked at how we could map that into a really measurable theory of change and a clear theory of change that showed the progression from each activity through, short, medium, and long-term outcomes, both quantitative and qualitative outcomes as well, because it's really important to capture both sides. And that took a little bit of work, and we involved all the delivery team within that, because they're the experts on the ground. Those are the ones that are out working with young people. They know, from the impact of what they do. They know what to do on the ground and the impact that has. So we involved the delivery team in the design of that theory of change. Once we had that in place, it was then a case of going to the MIS development team, so Upshot, so the developers at Upshot, and saying, look, this is our theory of change. We want this to be really measurable. So how will we go about this? So what we did, we built like a system where we had a range of activities. So the workers deliver certain activities. One-to-one sessions might be employability support, it may be transport training, it may be confidence building. And then what we did, we linked outcomes to those activity types. So we looked at the activities, the focus of that, and then what the perceived outcomes for that would be, and then built a matrix of activities to outcomes. That really made it easy for the workers when they were delivering programs on the ground. So when they register a young person onto a session and that young person completes that, they then close that register, and that activity type and the details of that activity, along with the perceived or the set outcomes, then move into the young person's profile and into their timeline. So within the timeline, we also knew it was important to gather those more tangible things as well. So that was looking at, if they achieve an accreditation, if they get a qualification, if they actually move on into employment, it was important to capture that, as well as what sector was that in, and was that part-time, was it full-time, is it sort of a temporary contract? So timeline events were used to capture those insights around those tangible things. But one of the key elements to timeline was actually the text part around that engagement. So when a key worker meets with a young person, they first of all discuss the actions that might have been set from last time. They may have asked the young person, look, to try and modify their sleep structure, go to bed a little bit earlier, try and set an alarm to get out of bed. It may be do some job search. It may be to catch a bus or to try and use some public transport. So they'll discuss the actions from previous meetings. They'll document that. They then also put a bit of narrative in around the context of today. So that may be doing a bit of job search. It might be looking for some support services for them if they have issues with housing or drugs and alcohol, something like that. It would be looking at the context of today and then setting the actions before next meeting, and then agreeing the date and time for that. One of the real benefits of following that structure is it's really so as if a key worker or a worker's absent, someone else can cover that caseload, can meet that young person and fully understand what it is they've achieved, what it is they've done last time, what their actions were, and what the focus would be for the next session. And that really limits the sort of negative impact on the worker's absence for that young person. So that means their support journey is more seamless, and it enables them just to move forward. Although we do try and have one dedicated worker to person, and that's the way you build up those real trusted adult relationships and working relationships.
Probably one more minute there, Gary.
Oh, sorry.
No, not a problem.
No, right. So what we realised really quickly was that we needed to really understand those more qualitative things, and we needed to embed a socio-emotional evaluation mechanism tool. So we developed the Me Tool, which looks at 10 areas of a young person's life and enables us to see those small incremental changes that happen as we move through that support journey. So we do a Me Tool assessment really early on in a young person's journey, typical at week 3, and then every 6 to 8 weeks after that. That enables us to see progress, to see regression. So if, for argument's sake, someone's not progressing as we thought, we can look at what's happened within that time frame and make adaptations to delivery, or we can look at the rate of meetings. Are we meeting? Do we need to relax or intensify the range of meetings? This also enables workers to see the impact that they have for that young person and the outcomes that young person's achieving. So that it really means the workers remain more engaged in that support journey because they understand the impact that they have. They can see it. It's down in the evidence base. To make it viable, we limit the caseload to 20. So a worker can meet a young person 1 hour a week, so 20 hours. That gives them enough admin time to actually make sure that they register all of that core information into the management information system. So allowing admin time was crucial to data capture and to make sure that it was consistent and that everyone was putting in information at the same quality standard.
Brilliant. Thank you,
Thank you.
Gary. I mean, that's music to my ears as someone in a research organisation, but I think it's also a really valuable case study, especially looking at young people, given that we know that the primary reason that young people are not in employment, education or training at the moment is unfortunately primarily because they are out of work due to a health condition or disability. So this is an example of knowing what works in this context and ensuring that you have the program's evaluation ready means that you can share those learnings in other areas. And it's really impactful when all staff are involved in the design and use of monitoring information as you've described and treat it as a tool rather than an administrative burden. You get a lot more insightful information recorded. So thank you, Gary. And then I'll hand on over to Catherine. Over to you for the same.
Thanks, Elizabeth. And hi, everyone. It's really great to be here today and hear that really interesting piece from Gary. So my name's Catherine Hale. I'm a disability researcher and co-production consultant. I have lots of personal and research experience around disability employment support that I'll share a little bit with you right at the end of my talk. But first, if we could go on to the next slide, please, Mira. I'm going to talk to you about the Wishes project, and about my role in Wishes is around co-production. So Wishes is a work and health trial funded by National Institute of Health Research. It's led out of the University of Strathclyde. It's a multi-institution project. Next slide, please. So a little bit about Wishes. Wishes is actually an in-work intervention aiming at improving the retention of employees with health conditions and disabilities, as well as other marginalised workers within organisations. Excuse me. It's a trial of job crafting. Job crafting is an employee-led form of job design that aims to improve the fit, if you like, between the person and their job. It's a randomised controlled trial, and it's the largest trial of job crafting that we're aware of to date, and the first trial to look at the outcomes of job crafting for workers with health conditions and disabilities. Next slide, please. Excuse me, move on with my own notes. So at the heart of Wishes is the principle of co-production. And this is the belief that services and programs are more effective when they're designed with disabled people and not for them. And by bringing together lived experience, professional expertise as equal partners, we will create interventions that are more relevant, more practical, and more likely to improve outcomes for disabled workers. Wishes is also grounded in the social model of disability. And this recognises that disabled people are often disabled by barriers in the workplace rather than by their health condition or impairment. And this means the interventions we're looking at are not around fixing the individual, but rather around changing the way that work is organised and the working environment to remove those barriers. Next slide, please. So how has co-production worked in the Wishes project? So myself and my colleagues work with what we call a co-production leadership team, which meets monthly or bi-monthly. And this team is made up of 3 different groups of lived experience expertise, which you can see in these blue blocks at the bottom here. So we have a lived experience group, which is around 15 individuals with diverse range of health conditions and impairments, as well as diverse socioeconomic backgrounds. We have our disabled people's organisation leaders. So these are disabled-led organisations and leaders who have experience in engaging with policy and employment support programmes. And then we have our core DPO partners who are Speak Up, Breakthrough UK and SIC that we've involved in specialist pieces of work, such as creating easy read formats. Co-production has happened across multiple work strands in Wishes. So to give you a flavour of this, they've been involved in the intervention design, and this is around creating, ensuring that the job crafting workshops are accessible, inclusive and relevant to disabled workers. They've been involved in the evaluation design. So, excuse me, got lost in my notes. So this is a range of evaluation tools, including qualitative interviews, baseline surveys, cost benefit evaluations. We've been ensuring that not only that the formats are accessible, but that we're measuring things that are relevant to disabled people in work. The co-production work is co-led by myself with Professor Catherine Runswick-Cole from Sheffield, and with a project manager also, Amy Hurst. Next slide, please. So to talk a bit about some of the challenges that we faced with co-production, you mentioned, Elizabeth, that this often comes up as a challenge in the studies that you've looked at. So I would say that the challenges or the barriers relate firstly to the complexity of the project itself with Wishes. So Wishes involves multiple work strands and multiple teams that are spread across different universities. And so when we're working with our co-production partners, it can be quite difficult to give them a holistic overview of the whole project, rather than the little bits of work that we're involving in, and explaining how all these different pieces of work fit together. It's also challenging to embed a new way of working. Co-production involves a novel way of working with co-production partners across not just one research team, but multiple research teams in different universities. The other challenge I thought I'd mention is with building and keeping relationships of trust with our co-production partners. Relationships of trust are the essential component of co-production, and our lived experience members bring a huge amount of experience and passion for changing the world of work. But we are not starting out the project with a blank slate, if you like. We're working with established models of job crafting from the literature, as well as standardized survey instruments that have been validated over time. So there's a tension between how far those standardized models and tools can be adapted to make them more accessible and relevant to disabled people, while still remaining faithful to the model itself, so that we keep the integrity of the trial for people who are going to evaluate, you know, how faithful it was to a randomized control trial, for example. Within those constraints around what can be changed and what can't be changed, how do we keep valuing the knowledge of our lived experience partners, which is so, you know, such a crucial basis for the trust that we need to work with them? Next slide, please. So the way that we've addressed this really has been around developing a process for embedding the knowledge exchange that needs to take place between co-production members and research teams. I've mapped out here a kind of process that we've developed for collaboration and communication processes that need to happen both before the co-production meeting with members as well as afterwards. I think I maybe don't have time to go through it all, but there's work that needs to be done with research teams to select the most appropriate topic, to develop accessible information, and to really, maximize the engagement that we can get from the meetings, as well as feeding back responses and decision making after the meetings. And at nearly all the stages of this process, research teams are involved, as well as co-production members, in planning meetings to make sure we get the best engagement from our members. This requires research teams adapting to new ways of working that do take more time but lead to better outcomes. And this is how we found the best way of valuing the knowledge that our lived experience partners brings to keep those relationships of trust alive. So thank you. Next slide, please, Mira. I'll just finish off with a little bit more about myself. I have a lot of experience, both lived experience and research experience around labour market activation programmes. I've been a recipient of disability benefits as well as employment support and activation interventions over many, many years due to my own long-term health condition. I've also led research in the past on user experiences of the work programme with Mind. I worked for an employment support charity for people with long-term health conditions called Astrid, and in that role I led research into our service users, their kind of needs and aspirations, as well as developing consultancy for businesses on supporting people with long-term conditions at work. More recently, I led research with King's College London into flexible working and disability inclusion from employer perspectives. Please do contact me. I've got my details here for anything more that you'd like to talk through around co-production or about disability and employment support. For more information about the Wishes Project, please contact our PI, Principal Investigator, who's Professor Adam Whitworth at Strathclyde University. Thank you very much.
Brilliant, Catherine. Thank you so much. So hopefully that has now provided you with some insights and perspectives of people having applied some of those things that we identified as effective best practice out there in the wild, and how that works well and what the key challenges can be. So a reminder, please use the Q&A function to ask our panelists any questions that you might have about what they have shared. And also, if you have any further questions about the review itself, Mags is still online to field them as well. But I get to use Chair's prerogative to kick us off for the Q&A section today. So Gary, a question to you first of all. So you talked us through the way that you went about setting up the approach and the benefits that it provided you. I wondered if there were any big challenges that you faced along the way in terms of collecting that management information and how you overcame them.
Yeah, the main one really was consistency of input from the from delivery team. It was kind of embedding those structures to make sure that everyone was following the same practice, the same process. But to keep on top of that, we really needed someone who could continually look at that data to look for any gaps, to look for any inconsistencies. So we actually employed a data administrator to look at that. And as Ipsos said at the time, for this, everyone needs a Callum. It was Callum we employed. So it was really a case of making sure that everything was consistent and things were being input properly or correctly, or where there were issues, looking at the process and making adaptations to process. But having someone with oversight to that was crucial.
That's really handy. I wish I had a Callum as well. And a question for you, Catherine. So if someone had identified that they wanted to take a co-production approach, how could program staff design and deliver co-production activities if they hadn't taken that approach before? Where would you want them to start? What's a good first step?
So which staff members are you?
Program staff, so people involved in design and delivery.
Yeah. I would say ideally bring in a co-production consultant, who's worked in this way before, who will kind of help you embed systems and processes. I guess that, to be honest, this is my first real co-production role, so I have learned so much from the start of the project. It's been going for 12 months now. I've learned from my colleagues. Amy has much more experience of co-producing interventions within the sort of health interventions within the NHS. My other colleague has a lot of experience of working with people with learning disabilities. So yeah, I think it's a really difficult question to answer, but I think that one sort of common kind of mistake in thinking that we've had to challenge really hard within Wishes is that co-production is something that happens in a silo, divorced from the other teams and the other areas of work. I guess you need to be clear probably about what can be co-designed and what has to be set in stone. Clearly, if you try and co-design everything, that's just not going to be kind of feasible. So I think probably firstly defining as a team what are going to be the most valuable parts of the program to co-design and co-produce, and to make sure that everyone that has that's involved in that work is on board with this process of co-production, and the fact that it's probably going to involve them. And it is going to take them more time and extra meetings, and no one wants more meetings. So that's like the resistance that you have to, looking back, I think we tried at first to sort of not bother the busy academics and professors too much, knowing how busy they are and that they don't want extra meetings. And that was a mistake. We had to sort of about 3 months in go, actually, you have to come to this meeting because, this is how co-production needs to work. It can't just happen over there in a corner with us. Yes, we have a co-production team with 3 staff members, but that doesn't mean that we can just do all the work with our lived experience members on our own. We absolutely have to involve you, and that is going to take more meetings. And the more that staff members, whether they're research team or program managers, can be involved from the outset in understanding that process and how they need to be involved and how co-production meetings are best facilitated and how to get the best engagement, I think the better the outputs that you'll get from that involvement work.
Brilliant. So not treating it, no, that's wonderful. It sounds like not treating it as a widget within the program, but something that works across it and enabling that. Yeah. And managing the expectations of what it will be able to achieve with participants, but also, as you say, with the team members.
Yeah.
We've had a question come in, Catherine, that's related to that. So someone has asked, on the basis of the co-production that has been done for the Wishes project, what types of changes to delivery or evaluation or anything really has come about because of that deep and genuine involvement of people with lived experience?
I hope you would ask that because there's been a lot really. So on probably the most important level, it's about ensuring that the workshops themselves, the key output, the key design, that the workshops are accessible, inclusive, that they are a safe space for people who may not have shared their impairment or disability with colleagues at work before. That's probably the most key thing. And obviously that all the survey platforms and instruments and everything are accessible as well. So, but the results have gone much deeper than that, I would say. In terms of the evaluation tools, there are sort of these standardized survey tools. I don't even know all the names of them, but there's like a workability index. There are lots of other kind of tools that have been developed by, organization behavior academics over many years that have been validated and that were going to be just imported and used in Wishes because they are the tools that you use, that everyone uses. When we took them to our lived experience groups, they were absolutely horrified by them. They said these are absolutely not social model of disability. These are embedding a medical model that sees the disabled person as the problem to be fixed. We can't even possibly answer these questions. They feel so ableist. So that was the first point of sort of like real, where realised there was a real clash of, you know, assumptions and ideologies, if you like, that, well, not ideologies, but assumptions that are absolutely embedded into kind of some of these survey instruments that researchers are not even aware of. So we really unpicked why is that the case? And we realized that this workability index is designed on the assumption that workers are basically healthy, but if they develop a condition, they might be at risk of becoming disabled. So the questions are all geared around, for somebody who's recently developed a health condition, and they absolutely don't work. For people who may have been disabled from birth or have acquired their condition a long time ago, they're just completely jarring. So one of our co-production wins was that we designed a new workability index, which is a big thing. If anyone here knows, you know, these tools, they're absolutely the gold standard. You know, you don't deviate from them. But we, with the research team, designed a new one that was more sensitive to the social model of disability. And not just that, but it had to be validated. You know, the researchers said, well, we can't just use this thing. So an extra piece of work was brought in to test it out and validate it. But also, you know, so many of these other tools have the same problems embedded in them, and we can't redesign them all. But I think it's brought awareness that some of these things are just designed on the assumption that disabled people are not in the workplace, and if they are, it's some kind of aberration that must be prevented. Whereas disabled people are, you know, absolutely in the workplace. It may not be visible, it may not be disclosed. So that was, and then the other thing was there's a thing with job crafting called a job crafting scale, which sort of gives indicators of what different types of job crafting that people might do. That again has been developed within the literature. When we talked to our lived experience members about job crafting and what it meant to them, the kinds of changes that they wanted to make in their jobs or had tried to make in their jobs were really, really different to the things that were on the traditional job crafting scale. So we were able to bring that to the research teams and go, look, we've, you know, got 50% of trial participants disabled. These are the kinds of things they like, the kinds of job crafting changes they're going to be wanting to make. So that was really interesting as well. And so the team has devised a new job crafting for health and disability scale that captures some of those things that we will be measuring and looking at in the evaluation. So those are the two of the wins that we're proud of in the co-production team.
Yeah, as you should be. Really, two things that really demonstrate the benefit of bringing people in to test those baseline assumptions. You think you have a validated measure, therefore it should be, you know, robustly tested, but comes with its own biases.
Yeah.
Fabulous. And Gary, a question for you here. Someone was interested in how did you go about getting the kind of the buy-in and other people on board to provide the time and resources that were required for improving the management information that you collected? It's not a cost neutral exercise to be collecting more things and validating it as well. So how did you get people to give their time and effort?
It was really by involving them from the not involving them in the journey from the start, really, and taking their views on board, and really, you know, not dismissing anything, and being willing and to adapt at any point. You know, if things aren't working right, you know, and things just aren't recording properly, or the process isn't right, you know, be honest about that, and really look for solutions, but involve staff in those solutions. So, you know, they feel there's validity there for them as well, because they're helping in the design of that. You know, when we were developing the ME tool, the My Evaluation tool, we involve young people in the design of that. It's the young people who are going to be asked the questions, who have got to, you know, following this structure. So it was finding out what areas of life were important to them, you know, and then what was the framework of questions like. So involving young people and workers in the design of the ME tool was key, because that then brought buy-in from both sides. Young people saw the value, the key workers saw the value, so therefore it implements and it works. So really it was through really involving through all stages of development, and regular team meetings to gather feedback, and to discuss challenges, to discuss where things are working really well, and reward people. One of the things we did introduce was a My Month in View card, which shows a worker at the end of each month their caseload, the active engagers, the partial engagers, the disengagers, their achievements that have happened, the time spent with young people, the barriers they've helped to mitigate, and the strategies they've helped to implement. So they get that in a month in view card, which really helps them see the difference they make.
I like that. So often the data that gets collected goes into a black box, never to be, seen by the people who collect it again. So making it useful to them, as well as, ensuring that it's recorded consistently for evaluation purposes, is a win-win. And I think there's a common theme there about treating these elements that we know are really effective as something that is embedded and built into the process throughout, and built into people's engagement throughout, rather than something that is tacked on at the start or the end and in isolation. Fabulous. I'm keeping an eye on time because that's my primary job here today. And we are coming to the end of our session. I just wanted to give Gary and Catherine, you both, the opportunity to make kind of like leave your final message to the attendees on the webinar today. If I can ask a very quick 30-second, what would you most like to impart in terms of a key message? I'm going to start with you, Catherine.
I think I've said it really. What the key thing I wanted to say about, co-production does take more time and involve more meetings, but it leads to better, more effective outcomes that are, more likely to move the dial on employment outcomes in the end. What I guess I was going to mention a bit more about that I didn't get the time to was the importance of ensuring the co-production meetings themselves are accessible and inclusive, and I've got learning to share about all the different measures we brought in. Obviously you offer adjustments. The importance of selecting a diverse group of lived experience members in the first place. We had about 100 expressions of interest to join our team, which was amazing, and 15 places. So the selection process was really, really tough, but it was aimed at sort of covering a diverse range of experiences, because clearly disability is not a monolith. But then offering adjustments, and those that we found most important around the meetings has been sending information in advance, ensuring there are breaks within meetings, offering members alternative ways of engaging if they're not able to make a meeting, or if meetings are not the best way for them to engage, and creating space for everyone's voices to be heard. And we found that the best way for us was having small breakout rooms with 2 or 3 people in them, and lots of team members involved in the meetings to facilitate, to take notes, and to manage the engagement within the meetings. That was really, really important, so that everyone's voice could be heard. So there's a lot of learning about how we've made the co-production meetings accessible and inclusive, hopefully, and I'm sure we have further to go, but yeah.
Brilliant. Thanks, Catherine. And over to you, Gary, your final words.
Yeah, accept that it's not going to be seamless. There are going to be challenges. It's going to challenge your perceptions about what you feel works well, and what you do really well, as opposed to what you don't do quite so well. So expect that and be honest about it. And if you're reporting back to funders, they would rather hear when you've had to make changes for a reason and receive factual, accurate numbers, than something that's been inflated or that's not reflective of actually what's happened. So expect the unexpected, be willing to make change, and be honest with your funders and with your workforce.
Brilliant. Good lessons for life as well. Alrighty. Thank you, everyone. I hope you'll join me in thanking our speakers for their time and perspective today. And also, I'd like to say a big thank you to Mags, the team at Learning and Work, and also our colleagues at the Institute for Employment Studies for all of their work behind the scenes on these reviews. As I said and Mags said, this is part of a wider program of work, and there are links in the chat for where you can find more information. And if you enjoyed this session, we have more webinars on the horizon as well. One coming up in September, focus on the recruitment of people with disability and health conditions, another in November about what works to support people to retrain, another in November about measures, tools and indicators to measure progress towards employment, because getting into employment is often a long-term journey. And then another towards the end of the year about what works to support disabled people and people with health conditions into employment for the first time. Thank you for attending, and we hope to welcome you again to a future webinar. So enjoy the rest of your day, and thanks for joining. Farewell.
Thanks, Mira. That was fab. Thank you.